Hello, everyone. We are on day 89 of the 90-day free NCLEX review series. And for those who just joined us in the chat room, welcome to the class. And I'm also inviting everyone to enroll to our NCLEX review at nclexcoaching.com. And today we'll be tackling Q&As regarding burns. So let's get started with our test questions. We have our item number 1. I hope that you can see the screen. All right, our first question. A patient who has spilled hot oil on their right leg and foot has skin that appears dry, pale, and firm. The patient reports no pain in the affected area. What is the most accurate term for the burn depth? A, deep partial thickness burn. B, full thickness burn. C, superficial partial thickness burn. And letter D, first degree burn. The correct answer here should be letter B. This is the full thickness burn, because in this type of burn, the skin will often appear pale. It will be dry and may have that leathery texture rather. And these type of burns actually typically will lack pain because of the nerve damage in the affected area. So take note about that. Now, why not letter A, deep partial thickness burn? This type of burn will often show the formation of the blisters. There's going to be redness or erythema. It is painful and like a full thickness burn. So A is incorrect. Now, what about letter C, superficial partial thickness burn? This is going to show us a red skin discoloration without blistering, and it doesn't really match the description provided in our question. Now, if you selected letter D, this is also incorrect. The first degree burns are superficial. There's going to be some redness, there's blanching, and there's pain, but no destruction to the deeper skin layers. Now, your focus here is to look into the description. Dry, pale, hard skin, no pain, and this is going to help you point out the depth of the burn and the full thickness type of burn. Let's have number 2. A patient admitted to the burn unit has sustained burns to the face, head, and hands. Initially, wheezes are noted, but an hour later, lung sounds are diminished and wheezes are no longer heard. Which intervention should the nurse prioritize? A, reposition the patient in an upright position and reassess lung sounds. B, document findings and continue monitoring respiratory rate. And C, notify the provider and prepare for potential intubation. And D, encourage the patient to cough and recheck breath sounds. Take note about the manifestations here. Initially, there's wheezing, but after an hour, the lung sounds are getting diminished and wheezes are no longer heard. Your answer here should be letter C. Very good, Stella. You're going to need to notify the medical provider this time because this change in the respiratory status indicates there is now worsening airway edema. This is going to necessitate the intubation. It needs immediate intubation to maintain patent airway. Now, if you selected letter A, reposition the patient in an upright position and reassess lung sounds, this can help the breathing, but it will not resolve the airway edema, which requires an artificial airway. Now, letter B, document findings and continue monitoring respiratory rate. This is insufficient action when you have a patient with a sudden change or there's a change in their breath sounds. This is not going to do anything. You're delaying treatment for letter B. If you selected letter D, encourage the patient to cough and recheck breath sounds. The coughing will not address the issue of airway edema, and it will be ineffective in improving the lung sounds in this case. So when you have a patient that has the classic burn, especially in the face or close to the trunk, you need to consider the risk of airway edema. You got to pay attention to that. And if you're going to see a change, especially in their breathing, if there's deterioration, you need this airway management to be addressed immediately. And in this case, we're going to have to do that notification to the medical provider. All right, this is a huge change. Let's have number 3. A patient with burns covering 40% of the total body surface area has been admitted. To ensure adequate nutritional support, what should the nurse plan to do? A. Provide vitamins and minerals intravenously. B. Place a feeding tube and start enteral feedings. C. Use total parenteral nutrition via central line. And D. Encourage a daily oral intake of 5,000 calories. What is your answer? Your answer should be letter B. That's the placement of a feeding tube and start enteral feeding. This is recommended early for burn patients to meet their nutritional requirements, and also this can maintain their gastrointestinal function, which is very critical in their recovery. Now, if you selected letter A, intravenous vitamins and minerals, this can be beneficial, but the vitamins and minerals alone will not meet the patient's caloric needs. So we're going to take that down. What about letter C? Use total parenteral nutrition, or TPN. This is going to place a higher risk of infection, especially, and this is something that is typically reserved for cases wherein the administration of enteral feeding is not possible. So take note about that. And if you select the letter D, encourage a daily oral intake of 5,000 calories. Well, oral intake here, take a look into that statement. Your patient with a total body surface area 40%, this patient probably is experiencing paralytic ileus or maybe other barriers to proceed with oral intake. So this patient is unlikely to consume enough calories without enteral support. So take note about the changes and the way they're going to be able to take in their nutrition. So your strategy here is for you to remember that enteral feeding is usually preferred to preserve bowel function, and this will also meet the patient's high metabolic demands. They are going to need the nutrition for tissue repair. However, the consideration about the patient's total body surface area, 40%, and possibly they are experiencing that paralytic ileus. So oral intake would not be really appropriate this time. Let's have number 4. A patient with a 25% total body surface area burn has the following lab results upon admission: hematocrit 57%, hemoglobin 18.5 milligrams per deciliter, serum potassium of 5.0 milliequivalents per liter, and serum sodium 136 milliequivalents per liter. What should be the nurse's priority action? A. Increase the rate of the prescribed IV fluid. B. Type and cross-match blood for a transfusion. And C. Monitor urine output every 4 hours. And D. Continue monitoring lab results. Take a look into the lab values here. Hematocrit 57, hemoglobin 18.5, and potassium of 5.0. What is your action this time? Your answer should be letter A. The elevation of the patient's hematocrit and also hemoglobin, these are actually signs that there is concentration of their blood cells. This suggests that the patient is having dehydration, right? So increasing the IV fluids will help prevent hypoperfusion to the tissues. All right. Now, if you selected letter B, type and cross-match blood for a transfusion. Now, I want you to refer into the lab values again. Is there a need for us to transfuse blood to this patient, especially with a hemoglobin of 18.5 and hematocrit of 57? there's actually hemoconcentration here rather than anemia. So the transfusion is not necessary this time. If you selected letter C, monitor urine output every 4 hours, that is insufficient. If you have this 25% TBSA burned and with a dehydration that is being assessed, your patient will require much more frequent monitoring of their urine output. You should be doing hourly urine output assessments, not every 4 hours. If you selected letter D, continue monitoring lab results, well, waiting to monitor without any action can actually worsen the fluid status, and this can lead to more complications caused by the reduced tissue perfusion because of the dehydration, right? You should eliminate letter D this time. This is inaction. You're not going to wait. So your strategy here in this test question, especially in this burn patient, you got to take a look into the labs, paying attention to the hematocrit. This signals that there's dehydration, and we really need to keep up with the increasing the IV fluid rate. And that's the first intervention to maintain the perfusion. All right, very good. I'm seeing lots of A's today. Wonderful. Let's have number 5. During the emergent phase following a burn injury, which assessment provides the best indicator of adequate fluid resuscitation? A, assess mucous membranes for moisture. B, evaluate hourly urine output. C, monitor for weight changes daily. And D, check for skin turgor. What is your answer this time? The best indicator for adequate fluid resuscitation. Your answer should be letter B, evaluating the urine output hourly. This is the most reliable indicator of effective fluid resuscitation. So you should expect at least half to 1 ml per kilo per hour output. So this will indicate that there is adequate perfusion and hydration. If you selected letter A, assess mucous membranes for moisture, this is less precise and may not accurately reflect the fluid resuscitation in burn patients because, of course, with the obvious injury to the skin. Now, if you have weight changes, if you selected letter C, this can actually fluctuate because of the third spacing and the fluid shifting. So this time, it will be less reliable compared to the hourly urine output. Again, in this particular case, wherein you have the scenario of burns, expect about the fluid shifting and also the third spacing. So monitoring the daily weight changes will not be as reliable compared to the hourly urine output. All right. If you could remember one of the cases that we had discussed way back, probably weeks ago, this was, I can't really fully remember the case, but it was about differentiating the most accurate way of detecting adequate fluid resuscitation, and it was something about weight changes, but it did not have a case. It wasn't a case of a burn injury, and so this was a totally different scenario. But you got to go into the scenario, make sure that you're going to consider all those possible factors as well. Now, if you selected letter D, check for skin turgor. Oops, sorry. If you selected skin turgor, this is also incorrect. And the reason for that is because it's not going to be as useful in burn patients due to the altered skin and the dynamics of their fluids after the burn injury is totally deranged this time. So this is not going to be reliable, also with the assessment of the mucous membranes. Now let's have our item number 6. A nurse is managing a patient with burns on the ears, head, neck, right arm and hand. Which positioning technique should the nurse use? A, position the right arm and hand in a flex position for comfort. B, raise the arm and hand on pillows and keep the fingers extended. And C, place the patient on their back with a small pillow under the head. And D, position the patient on their side with a rolled towel under the neck. So take a look where the location of the burns is. So it's on the ears, head, neck, right arm, and hand. So what should be the correct positioning for this patient? Your answer should be letter B. Okay, so when you're raising the right arm and hand on the pillows and also extending the fingertips, or the fingers rather, it can help reduce the swelling, and it will also prevent the contractures. Now, what you're going to do here is to really prevent the flexion in order to maintain full range of motion. All right. Again, you're going to have to raise the right arm and also extend the fingers, and this is to prevent the contractures. You're going to avoid flexion this time. If you selected letter A, position the right arm and hand in a flex position for comfort. Again, this is going to lead to the contractures. It will limit motion in the long term. Now, if you selected letter C, place the patient on their back with a small pillow under the head. This can also increase the pressure on the burned ears, and it can also cause discomfort and also sticking. Remember that the location of the burn is in the ear, and ears, head, neck, and the right arm. Now, if you selected letter D, this is also incorrect. The side lying position with a rolled towel under the neck could also lead to the contractures in the neck, and also the restriction of movement can follow. So in this case, you need to look for those answers or answer to prevent the complications like swelling or the contractures. So that would be letter B. Let's have number 7. A patient with burns encircling both legs reports a decrease in dorsalis pedis pulse strength and numbness in the toes. What action should the nurse take first? A, monitor the pulses every hour. B, alert the healthcare provider immediately. And C, raise both legs on pillows to elevate above heart level. And D, encourage the patient to flex and extend the toes. What is your answer this time? There is decrease in dorsalis pedis pulse strength and numbness in the toes. Your answer should be letter B this time, because this change will indicate there is now a compromise in the circulation, and this is going to require that procedure we call escharotomy in order to restore the blood flow. We have an issue of circulation this time. This is a high priority issue. Now, what is that escharotomy? This is a procedure that is done to treat the deep, full thickness, especially with third-degree type of burns that can happen in severe circumferential burns. And it can also lead to that compartment syndrome, right? That's correct. This is really going to restrict the blood flow into the particular area. And if it's happening probably in the upper body parts, it can also compromise the breathing. So in this case, the burned skin will actually form that thick leathery crust. We call that as an eschar. And so this is something that will not really expand. So the underlying tissues, especially muscles, will start to swell up, and they're going to be inflamed. There's going to be accumulation of fluid. It can also compress the blood vessels and some nerves, and it can even restrict the chest movement if the affected body part is in the upper trunk. So this is a procedure that will be done in strict sterile conditions. and they're going to do incision to relieve the pressure. It will allow the tissues to expand, and this hopefully can restore the blood circulation to enable perfusion to that distal extremity. Now, if you selected letter A, monitor the pulses every hour. Just monitoring this time and looking into that, there is already a decrease in the pulsation and strength, and there is already numbness. Numbness is never good, especially if it is associated with a decreased perfusion. This is the lack of blood supply, right? And with that, this is an immediate risk. We need to make sure that the doctor is, or the physician is notified right away. Now, if you selected letter C, raise both legs on pillows to elevate above heart level. This will not alleviate the circulation issue caused by the eschar. Remember, that is actually kind of like have that constrictive effect into the underlying tissue, and there's swelling underneath. And letter D, encourage the patient to flex and extend the toes. Well, the movement will not resolve with the lack of the circulation to the burns due to the burn circulation constriction. So take note that the location we have is in both legs, right? And that's why there is a lack of dorsalis pedis pulse, and also the feeling of the numbness. Again, this is an urgent situation that is actually compromising the patient's circulation to the distal extremity. So we need to notify the medical provider urgently. Now let's have number 8. For a patient with partial thickness burns scheduled for wound debridement, which medication should be administered for pain management? We have our options: lorazepam, B, ketorolac, C, gabapentin, we have D, hydromorphone. What is your answer this time? Your answer should be letter D. And this is an opioid medication. It will provide the patient strong pain relief, which is suitable for severe pain, especially that we're talking about scheduled wound debridement. That's very painful. If you selected letter A, that's incorrect. This is an anti-anxiety medication. It's not used for pain relief. If you selected letter B, ketorolac, this is a non-opioid medication, but it's not going to be effective enough to treat the severe burn pain, especially that the patient is scheduled for a wound debridement. And for letter C, gabapentin, this is intended for nerve pain, and it's not going to be sufficient for acute debridement pain. So what your priority is going to select that opioid medication that is going to be appropriate for this kind of procedure. This is debridement. We're talking about a surgical procedure. Now let's have our number 9. For a patient with burns over 30% of the body who begins to produce increased urine output, what should the nurse prioritize to support kidney function? A, monitor urine output regularly. B, check white blood cell counts. C, confirm the decrease of blisters and edema. And D, encourage adequate calorie intake. What do you think? Take note of the assessment. Begins to produce increased urine output. So what you should prioritize. And we are focusing on the kidney function. Of course, there you have your clue right there. Your answer should be letter A. Measuring the urine output will help you ensure that the patient is moving from the emergent to the acute phase, wherein there's going to be increasing diuresis, and the capillary integrity is going to be restored. That is going to be expected this time. Now, if you selected letter B, check white blood cell counts, this is going to assess the patient's infection risk, not about kidney function. So eliminate that one. If you selected letter C, confirm the decrease of blisters and edema. Well, if we're talking about blister edema resolution, this is going to be gradual and it will be less immediate for kidney function. And for letter D, encourage adequate calorie intake. This is supporting healing, but it doesn't really impact kidney function directly. So your focus here is to look for that action that directly monitor the kidney function. And that is checking into the hourly output. Wonderful. I like seeing your answers. Letter A's. Number 10. A burn patient with burns on the arms, legs, and chest becomes agitated and restless 8 hours post-admission. What is the nurse's initial action? A. Check oxygen saturation with pulse oximetry. B. Assess the patient's level of consciousness and orientation. C. Provide reassurance at the bedside. And D. Administer morphine as prescribed. Patient becomes agitated and restless 8 hours post-admission. Your initial action this time should be to select letter A, because the agitation this patient is manifesting, the restlessness, this indicates that there is hypoxia. Okay, take note about where the location of the burns is. It's actually located in the arms, legs, and chest. So, associate that with the hypoxemia, the agitation, the restlessness. Those are signs of low oxygen levels. So you gotta check first the patient's oxygen saturation in order for you to determine if there is respiratory compromise. Now, if you selected letter B, this is also important, but this is secondary to confirming the oxygen saturation. Your patient here is having hypoxemia, perfusion. That's the issue this time, oxygenation. So the level of consciousness can be considered as second priority this time, not really the best answer. For letter C, provide reassurance at the bedside. This will not alleviate the hypoxia that is present in our patient. If you select the letter D, administer morphine as prescribed. This might be indicated. Who knows if the patient is in pain? But you gotta have to check first if the patient is hypoxemic or not. Because if you're gonna administer the morphine and then your patient is already restless and agitated, probably this can worsen the patient's condition. So first, you're going to have to identify the airway and oxygenation. These are the primary concerns in this patient. You got to rule out first what's causing this one. Okay, let's have number 11. A patient arrives at the ED with burns to the face and chest after a house fire. Which action is the nurse's top priority? A. Administer the ordered dose of hydromorphone or dilaudid IV. B. Check lung sounds. C. Start the ordered lactated ringers IV. And D. Assess the depth and extent of burns. Patient has burns in the face and chest after a house fire. What do you think would be the best answer here? I'm seeing letter B's. Okay. Again, take a look where the location of the burns. Chest and the face. Top priority. You should be selecting letter B this time. That is to check the lung sounds. Because we know that burns occurring on the face and the chest can indicate a high risk for airway compromise due to the possible inhalation injury. Again, you just don't consider about the obvious, right? Like looking into the skin. But other than that, if there's actually involvement of their airway, This can also lead to the inhalation injury. So you need to prioritize the airway and also the breathing in this patient. So you can do that by verifying the lung sounds, of course. This is going to give you initial information about their respiratory status. Now, if you selected letter A, administer the ordered dose of hydromorphone, do you really want to put that as a priority? We can assume that the patient probably is in pain, but with the case right now, it doesn't really reflect anything about the urgency to administer the pain medication. I know that the patient could be in pain, but it's not reflected in the case scenario. But this is something that you can do after you have established or stabilized the patient's airway, which is the main concern in this case. Again, you got to be worried about the patient's airway this time, since the location of the burns is in the chest area and the face, plus the possibility of inhalation burns. All right, the inhalation of smoke, that's going to be another red flag. Now, if you selected letter C, start the ordered lactated ringers IV. This is also critical, but you should also follow the airway, breathing, circulation. All right. Now, letter D, assess the depth and extent of the burns. This is also important, but this will follow after you have secured or at least verified that their airway status is stable. Okay. So in this type of case, especially with the facial burns, again, I can't emphasize enough about this. You got to be worried about airway. And this should take priority than the rest of the other options here. Okay, let's have number 12. 8 hours after sustaining burns that cover 50% of total body surface area, a 92-kilogram patient's condition is being monitored. Which findings should be reported immediately to the healthcare provider? A, blood pressure of 96 over 45 mmHg from an arterial line. B, heart rate of 108 beats per minute on the heart monitor. And C, urine output totaling 45 mLs over the past 2 hours. And D, serous fluid leaking from the burn wounds. 50% TBSA, imagine that. Which finding that you should report immediately to the healthcare provider? That would be what? Letter C. You got to check the, look at this one. Urine output totaling 45 mLs over the past 2 hours. This is a worrisome issue here, because during the initial stage following the severe burns, the urine output should ideally between the half to 1 mLs per kilo per hour. This is oliguria. This is reflecting hypovolemia, and we need to resuscitate this patient with fluids, IV fluids. If you selected letter A, blood pressure of 96 over 45 mmHg, we know that is low. This is expected in the emergent phase, but is it that critical though? Is it looking very critical? I don't think so. Our main goal during the immediate phase or emergent phase is to keep the systolic blood pressure over 90 mmHg. Our patient's blood pressure is 96 over 45. Again, the goal during the emergent phase is to keep the patient's blood pressure, systolic blood pressure specifically, over 90 mmHg. If you selected letter B, heart rate of 108 beats per minute, it's not concerning, and this is common to the body's stress response. Now, if you selected letter D, this is also incorrect. Of course, you're gonna expect leakage of serous fluids from their burn wounds. This is expected. Now, again, your strategy here in selecting the option would be to remember the hourly, the average normal urinary output. This is going to give us an idea how the perfusion to the kidneys is, and it will give us an idea on how the volume that we should be doing, especially when we are giving them the IV fluids. Okay. How to check the chest if chest is affected. What do you mean by that? If we are checking, of course, we'll be able to do that through obviously by doing the visual examination, right? And again, with the proximity, of course, with the area that is being affected, the chest area, if the patient had sustained the burn into that area, we are going to have to anticipate that they might also have inhalation injury, inhalation of smoke. And that's something that you should also anticipate, okay? And what we can do here is to listen for the lung sounds. You can probably detect if there's any changes, maybe stridor, narrowing of the upper airways, or could be the lack of air exchange, diminished breath sounds. So that's something that you should be doing. All right, let's have number 13. An unconscious patient rescued from a house fire with bright red skin arrives at the ER. What should be the nurse's first action? A. Place the patient on 100% oxygen using a non-rebreather mask. B. Assess for singed nasal hair and dark oral membranes. C. Check mental orientation. And D. Start 2 large bore IV lines. Look back into the question. An unconscious patient rescued from a house fire with bright red skin arrives at the ER. Unconsciousness. That's a huge thing. That's already a huge information right there. Why would they become unconscious? Is it possibly because they have inhaled way too much smoke? That's a possibility. So what would be your intervention this time? Your answer should be letter A. Place the patient on 100% oxygen using a non-rebreather mask. All right. The bright red skin color suggests that the patient has carbon monoxide poisoning, and you need to reverse that by administering high concentration oxygen. That is our immediate nursing intervention in order to improve their oxygen saturation. And this will also displace the monoxide from the hemoglobin, carbon monoxide, I should say. So you need to hyperoxygenate them, give them 100% oxygen via non-rebreather mask. This is a sign of carbon monoxide poisoning. If you selected letter B, C, and D, these are incorrect options. Assess for singed nasal hair and dark oral membranes. This is necessary for much more further information, but you should follow oxygen administration at first. Look into the state of your patient and consciousness with the bright red skin. These are already important findings that reflect that there is carbon monoxide poisoning. Now, if you selected letter C, check mental orientation. This is something that you can do at a later time. This is less urgent. You should address first the patient's breathing and also circulation, perfusion, oxygenation. And for letter D, start 2 large bore IV lines. This is also important, but not as immediate as securing the patient's oxygenation. You need to manage the patient's air exchange, gas exchange issue. All right. Again, look for the signs: bright red skin and consciousness. Those are huge information to consider. Let's have number 14. During rounds, the charge nurse notices several actions by a new burn unit nurse. Which action requires immediate and correction? A, using clean gloves to apply antibacterial cream to a burn wound. B, taking burn cultures for a patient with a temperature of 95.5 degrees Fahrenheit, 35.2 degrees Celsius. And C, administering fentanyl IV 5 minutes before a dressing change. And letter D, contacting the provider for elevated blood glucose in a non-diabetic patient. You're going to look for that option that reflects immediate correction is needed. What is your answer here? Your answer should be letter A. What you need to have this nurse do is to use sterile technique. So this person should be using sterile gloves, not clean gloves, especially when they're treating open burn wounds. And this is to prevent infection. So you gotta deal with that right away. Now, if you selected letter B, taking burn cultures for a patient with a temperature of 95.5 degrees Fahrenheit, this is hypothermia. This may signal that there could be a possible infection. So this can be justified by collecting the burn cultures. If you selected letter C, administering fentanyl 5 minutes prior to the dressing change, actually this is appropriate because the medication will peak around the time when they're going to be doing the actual dressing change. So this will promote much more of effective pain relief. All right. Now for letter D, this is also incorrect. Contacting the provider for elevated blood glucose in a non-diabetic patient. We know that stress and increasing caloric intake can spike the patient's blood sugar, even in non-diabetic patients. And we need to also report that, but it's not going to be the erroneous action. This is an action that actually reflects what do you call this? Proper communication to the medical provider whenever there is elevation of the blood sugar. Okay, so we are selecting the wrong action committed by the brand new burn unit nurse. Okay, let's have number 15. A nurse is planning care for a patient in the rehab stage following burns to the right arm and chest. Which action should be included in the plan? A, use water-based lotion on the burn areas frequently. B, position the right arm for comfort. C, explain the purpose of tetanus vaccination. And D, avoid using long-acting narcotics. Your patient is in a rehabilitation stage after they had sustained a burn to the right arm and chest. So what should be included in the care plan? Your answer should be letter A. That is using water-based lotion on the burn areas frequently. Because this will keep the healing skin hydrated. It will make it less itchy, which can promote the comfort. And also it will promote skin integrity during the rehabilitation phase. Okay. It's not a joke to have this kind of burns, especially. I have sustained burns before, and it's no joke. I still have residual different sensations. If you selected letter B, position the right arm for comfort. This can lead to contractures. Instead, it should be extended to prevent stiffness. Remember what we had in the previous scenario regarding that burn affecting the arm of the patient? We gotta promote that extension rather than the flexion, because we know that flexion can cause the contractures, right? Now, if you selected letter C, the tetanus immunization would have been given during the early phase, during the immediate phase, not rehabilitation. So this is incorrect. If you selected letter D, avoid using long-acting narcotics. Well, The opioid medications may still be needed in the rehabilitation to control pain. So it's not entirely correct that we can avoid the long-acting narcotics this time. They will still have residual pain. So when you are answering this type of question, especially a patient in rehabilitation, what you need to focus here is to look for those interventions that will support skin healing and the prevention of the complications such as the contractures and dryness of the skin. Let's have number 16. What is the most crucial nursing action for a patient who experienced a burn injury while working on an electrical power line? Is it A, evaluate the contact burns, B, monitor the blood pressure, C, secure the cervical spine, and D, assess the patient's level of consciousness and orientation? Looks like this patient sustained electrical type of burns. What would be your answer here? Your answer should be letter C, because for those patients that have electrical type of burns, they are often associated with cervical spine injuries. So you need to stabilize the cervical spine after you ensure that their airway is stable, okay? And this is to prevent potential spinal cord injuries, okay? Take note of that. For electrical type of burns, spinal cord injury, especially cervical spine injury, is very common. So you need to secure this after you had stabilized the patient's airway. That would be the sequence. If you selected letter A, evaluate the contact burns. This is important, but this is secondary to ensure the spinal stability, especially that the patient has this kind of burn, electrical power line. This is electrocution type burn. If you selected letter B, monitor the blood pressure, this is also part of your routine assessment, but it's not the immediate priority when you need to stabilize the spine, okay? And for letter D, assessing the patient's alertness and orientation is necessary, but it's not as urgent compared to securing the cervical spine in this case scenario. Again, take note about electrical burn injuries. Most of these patients will be having spinal cord injuries first, especially the cervical spine, because of the possible electrocution. Okay. NCLEX questions are so frustrating. Tell me about it. Yes, they can be, but you gotta have to face the problem, right? You gotta have to deal with it. You gotta do some more practice, and you gotta learn from all these hard questions so you can pass the exam. And take note that we're gonna be, when you're gonna be an RN, you're going to be dealing with so many issues that you will not expect. There's so many untoward events that you'll be facing. And so actually the test questions are just preparing you for the real world. It's no joke out there. There's so many technicalities that are involved in the test question. And this is something that you can learn. So you have to develop that test taking strategy as well, and make sure that you have to apply what you've learned in the basic concepts. All right, let's have number 17. A nurse is reviewing lab results for a patient who suffered a significant burn 48 hours ago. Which result should prompt immediate action from the nurse? A, hematocrit of 54%. B, serum sodium of 148 milliequivalents per liter. C, serum potassium of 6.2 milliequivalents per liter. And D, blood urea nitrogen of 34 milligrams per DL. Which result should prompt immediate action from the nurse? Look into the values individually. Hematocrit, do you think that this is something that would call for immediate action? 54. This indicates high hematocrit level, so possibly indicates dehydration, possibly fluid shifting. At that level, 54, it's not that urgent compared to the answer that we're looking for. The correct answer here is the hyperkalemia, 6.2. Remember the value of 3.5 to 5 milliequivalents per liter. Anything above 5 would be concerning, especially that you have a patient that had significant burns. The hyperkalemia alone can be life-threatening. It can lead to the cardiac dysrhythmias. You need to monitor this patient immediately. You make sure that this patient is continuously hooked into the cardiac monitor, so you'll be able to identify those life-threatening arrhythmias, so you can treat it in order to lower their potassium concentration. Okay, if you selected letter B, sodium of 148 milliequivalents per liter, slightly above the normal, 135 over 145, but it's not immediately life-threatening compared to the potassium level that we are seeing. If you selected letter D, blood urea nitrogen of 34, our value ranges from 7 to 20 milligrams per deciliter. 34 is above the normal range, and this level indicates that there is dehydration. But do you think that this is much more urgent compared to the potassium, which can affect the cardiac rhythm? We're going to select potassium, which is 6.2. Okay. Now let's have number 18. A patient with significant electrical burn injuries arrives at the emergency department. Which prescribed action should the nurse prioritize? A, evaluate the pain level. B, connect to a heart monitor. C, verify potassium levels. And D, measure oral temperature. If your patient has significant electrical burn injuries arriving at the ED, so what you should prioritize in this case? Your answer should be letter B. That is, connect the patient to the heart monitor because of the life-threatening dysrhythmias after the electrical burn. Okay, so you need to make sure this patient is going to be connected to the continuous heart monitoring to detect any cardiac complications. If you selected letter A, evaluate the pain level. This is important for managing the pain and also promoting comfort, but it's not as critical compared to monitoring for the arrhythmias, right? If you selected letter C, verify potassium levels. We know that this is important, but it will take time for the lab results. So what we need to do here is to immediately connect the patient to the cardiac monitor. Again, the impact of the electrical burn, the electrocution, actually will have a much more impact directly to the heart rhythm. So we need to do that initially. Now, letter D, measure oral temperature. This is also important, but it's not a priority intervention compared to the patient's assessment through heart monitoring. So when you're going to look into this kind of a situation, you're going to have to prioritize the ABCs. Remember that: airway, breathing, circulation, and other immediate life-threatening complications. So that could be dysrhythmias, especially in the case of electrical type of burns. All right. Let's have number 19. Let's take a look into this scenario. It states the nurse is providing care to a 60-year-old male client who was transported to the ED by paramedics after he attempted to put out a car engine fire using a blanket. He was brought into the ED for evaluation and treatment. Now, looking into the nurse's notes, At 10:15, the client's hands and fingers are red and swollen on both sides. His shirt sleeves are cinched up to the elbows, and there is redness and blistering between his elbows and wrists. He has full thickness burns on both wrists and on some fingers. His face and neck show blackened areas from soot and smoke exposure. The client is coughing, drooling, and is seated with his elbows on his knees, indicating a tripod position. Now, your task here is to identify one possible condition the client may be experiencing, 2 nursing interventions to address the potential condition, and also to select 2 parameters to monitor for assessing the client's progress. So we do have a bow tie type of question here. So this is what you're going to see in the exam. You're going to have that main well at the center, which you're going to be asked about the potential condition. So we have the following options for the potential condition. These are your nutritional deficiency, respiratory distress, upper extremity contractures, intense pain. And for the nursing action options, you have administer IV morphine, get ready for intubation, assess peripheral pulses, inspect nose and mouth for soot particles, and lastly, promote intake of high-calorie food items. And the options for parameters to monitor are lung sounds, condition of burn dressings, pain levels monitored every hour on a 0 to 10 scale, monitor fluid intake and output, check oxygen saturation. Okay, looks like you've answered the potential condition. And what is the answer to that one? Correct answer. That should be the what? Respiratory distress. Basing into the patient's case, the client has been exposed to the smoke and also the heat. And so this patient is at risk for the respiratory distress. Looking into the scenario as well, look into the chart, the nurse's notes. The client is coughing, drooling, and is seated with his elbows on his knees, indicating a tripod position. So this reflects that the patient could possibly have inhaled smoke, which can cause the airway to inflame and swell up. So this can potentially block their airway. Now, aside from that, there could be possibly particles of soot or maybe toxic gases, could be carbon monoxide that can also impair the gas exchange. So this will really make a patent airway a priority this time. Okay. Now, what would be the nursing actions to support? That would be get ready for intubation. Okay. Why? Well, of course, the patient is already having their respiratory distress. Okay. And the patient has that risk of airway obstruction from the inhalation injury. So you need to be ready for the intubation. Especially if they have inhaled heat or smoke, this can cause rapid swelling of their airways, and the intubation can really secure their airway before further inflammation can happen. Okay. The other intervention that you should be doing here will be to inspect the nose and mouth for soot particles, as we know that possibly the patient could have inhaled soot. And identifying these particles will also help the nurse to assess the extent of the inhalation damage. All right. So why not administer IV morphine? We know that pain control is necessary, but again, our priority here is the patient's airway. We need to secure the airway, as we know that the patient is in respiratory distress. Okay. Now, if you also selected that IV morphine, this might also cause respiratory depression. So this can possibly worsen the patient's case. We know that we can administer pain medication, but you gotta be careful when administering narcotic or opiates when they have a compromise in their airway, because this can worsen the respiratory distress. Now, if you selected letter C, assess peripheral pulses, this is incorrect. This is important, of course, right? But identifying the respiratory distress, which is the main concern here, this action will not support to that main problem. This is something that you can do if there is an issue with possibly circulation to the lower extremities. Maybe if there is burn to the lower extremities. Yeah, but not here. Now, if you selected promotes intake of high calorie food items, this is also important. This can help meet increased metabolic demands from burn injury. However, again, this will not help in meeting the patient's issue, which is basically the airway. Right? Our immediate issue here is the airway. Now, what about the parameters to monitor? I'm seeing lung sounds. Okay. One of those answers will be to check for the breath sounds or lung sounds. This will also give us an idea if there's going to be signs of respiratory distress or could be obstruction. And if there is going to be decrease, or if there's going to be appearance of abnormal breath sounds, let's say stridor, this can indicate that the patient may have obstruction in the airway, or maybe they are having atelectasis or lung collapse. Now, what else are you going to select here? Aside from the lung sounds, we have other selections here: condition of burn dressings, pain levels, monitor fluid intake and output, check oxygen saturation. Which of the parameters here will also support the respiratory distress? Of course, no other than check oxygen saturation. This will help assess the client's oxygenation and gas exchange. And we really need to identify if there's going to be hypoxemia this time, especially that the patient is already in distress. There is airway compromise. Now, if you selected the other options, let's say the condition of burn dressings, this is important. But this is more of wound management that we can address after we have stabilized the patient's airway. And if you selected monitor fluid intake and output, this is also important. But again, you have to secure the airway first. ABCs first. Okay? If you are addressing the fluid intake and output, this is more of circulation. You got to follow the hierarchy: airway, breathing, circulation. We know that urine output is something that you can associate with circulation, perfusion to the kidneys. So follow the hierarchy of need. What about pain levels? Monitored every hour on a 0 to 10 scale. This is also important, especially for partial thickness burns. But again, you got to secure the airway first. All right, so I hope that you're learning from this Q&A. And we're going to have another session tomorrow, finally, for sepsis. And I hope that I'll see you again tomorrow. And let me know if you have any questions. You can direct the questions in the comment section. We'll try our best to get to your questions as soon as we can. And please don't forget to hit the like button and subscribe, and also share this to your friends who are also preparing for the NCLEX. Tomorrow is the last day. We will miss your lectures. Hopefully it won't be the last. Yeah, so you have to stand by for more updates from us. And hopefully there's going to be more in the future. So hang tight and just stay tuned. Alrighty. Well, everyone, thank you so much for your time. I really appreciate your participation. Yeah, your participation with all your answers in the chat box. I do appreciate them. Very good, very good. All right, I'll see you again tomorrow. You all take care, and you all have a great day. Bye, everyone. Oh, we have a question here. Where should I see these previous video? We actually have the previous lectures in our live stream. So when you go into the YouTube channel, there are different tabs, right? So there's like videos, live. You go into that tab which says that live stream or something live. So you should see those older sessions there. All right. Thank you, everyone. I'll see you again. Take care.